In 2017, healthcare industry outsiders, barely known by anyone, dared to disrupt a notoriously traditional industry by solving problems that no one wants to talk about, at least publicly. Hims & Hers Health Incorporated has emerged as a significant force in the telehealth sector, fundamentally reshaping healthcare delivery through its direct-to-consumer, subscription-based model. How did a company that started providing solutions to what some might consider taboo health topics grow into a billion-dollar enterprise, thriving in a difficult market niche where other companies have struggled for survival? Let's delve into the fascinating story of Hims & Hers. In this video, we'll look at the origins, growth, strategic expansion, challenges, and future prospects of Hims & Hers Inc. It all began when a visionary entrepreneur, Andrew Dudum, was working at a venture studio, Atomic Labs. Dudum observed a significant gap in the healthcare system. People, particularly men, were often reluctant or embarrassed to seek professional help for common yet sensitive health issues. The traditional healthcare model, with its inconvenient in-person visits, long wait times, and often stigmatizing environment, was failing to meet these fundamental needs. The rationale for Hims was clear: break down these barriers. The founders, Andrew Dudum, Jack Abraham, and Hillary Coles, saw an opportunity to leverage technology to provide convenient, private, and affordable access to healthcare services for conditions that people often searched for online, indicating a desire for discreet and readily available solutions. This wasn't just about selling drugs. It was about creating a platform where qualified medical professionals could deliver digital health services and address a yearning need for solutions to private health issues. Hims Inc. was officially launched in 2017, focusing on men's health, specifically hair loss and erectile dysfunction. This was a strategic entry point, targeting conditions that were widespread but often unspoken, especially in public. The company's initial focus was addressing common conditions that frequently cause social anxiety, specifically hair loss and sexual health issues. This targeted approach allowed Hims to establish a strong foothold by catering to a clear, underserved need with discrete solutions. The success of Hims served as proof of concept and quickly demonstrated the broader applicability of their model. In 2018, the company expanded its offerings to women's health and rebranded as Hims & Hers. This expansion brought in services and products related to birth control, sexual health for women, and further skin and hair care solutions. This expansion introduced services tailored to women's health needs, including birth control pills and flibanserin under the Hers Inc. brand. This sequential diversification, moving from a men's health focus to women's health and subsequently evolving into a multi-specialty platform, demonstrated a calculated application of their proven digital-first model of discrete care. This allowed for the efficient broadening of their offerings and the capture of a wider market share beyond their initial niche areas. Hims & Hers fundamentally addresses several systemic barriers within the traditional healthcare system, including the lack of convenience, prevalent privacy concerns, and issues related to affordability, particularly for health conditions that have historically carried significant social stigma. The company's platform functions as a streamlined digital conduit, efficiently connecting patients with licensed physicians. Within this digital environment, doctors conduct online consultations, develop personalized treatment plans, and issue prescriptions for medications, all designed to be accessible from the comfort and privacy of a patient's home. But what is the magnitude of the issues that Hims & Hers is trying to address? The market opportunity for Hims & Hers is substantial, given the high prevalence and significant treatment gaps across its core therapeutic areas. Let's look at the numbers. Erectile dysfunction. This condition is highly prevalent, affecting an estimated 24.2% of U.S. adults based on IEF-5 scores. More specifically, approximately 52% of men in the United States between 40 and 70 years of age are estimated to experience erectile dysfunction. Despite its widespread nature, a significant treatment gap persists. Only 7.7% of individuals who meet the diagnostic criteria for ED reported having been diagnosed by a healthcare provider. The substantial discrepancy between the high prevalence of ED and the low rates of diagnosis and treatment indicates a vast, largely untapped market. Hair loss. Hair loss affects millions globally, with women accounting for as many as 40% of those experiencing it. Across their lifetimes, approximately 85% of men and 33% of women will experience some form of hair loss. By the age of 65, an estimated 53% of men and 37% of women will experience baldness. Mental health. A significant portion of the adult U.S. population grapples with mental health issues. Approximately 23.08% of adults, equivalent to nearly 60 million Americans, experienced a mental illness in the past year, with 5.86% experiencing a severe mental illness. Despite this high prevalence, over 28 million adults with mental illness did not receive any form of mental health treatment, indicating a substantial unmet need for accessible care. Weight management. Overweight and obesity represent pervasive public health concerns in the US. Nearly 1 in 3 adults, 30.7%, are overweight, and more than 2 in 5 adults, 42.4%, have obesity, including 9.2% with severe obesity. Recent data from August 2021 to August 2023 indicates the prevalence of obesity among adults was 40.3%. Hims & Hers operates primarily on a subscription-based telehealth model, which serves as the bedrock of its revenue generation and patient engagement strategy. This direct-to-consumer approach bypasses many traditional healthcare intermediaries, offering a streamlined experience. The documented surge in telehealth utilization, increasing from 11% in 2019 to 46% in 2022, coupled with high patient satisfaction rates of 82.5%, strongly indicates that Hims & Hers' digital-first model is not merely innovative but is perfectly aligned with a major, ongoing societal shift in consumer preference for healthcare delivery. This macro trend provides a significant tailwind for their business model, as it validates the fundamental operational choice and contributes to the company's exponential growth. The subscription-based revenue stream is the dominant financial driver for the company, constituting over 90% of its total revenue. The efficacy of this model in fostering enduring patient relationships is evidenced by a robust customer retention rate. The subscription model encourages continuity of personalized care, which often leads to improved patient outcomes and a stable, recurring revenue base. This fundamentally differentiates Hims & Hers from traditional fee-for-service healthcare models. The company now offers a comprehensive suite of healthcare solutions, strategically diversified across 5 key primary verticals. These include sexual health, which contributes approximately 30% of total revenue, mental health, accounting for 25%, dermatology, contributing 20%, weight management, a rapidly growing segment projected to generate $725 million in revenue in 2025, and primary care, an expanding area focused on chronic condition management. This broad portfolio allows Hims & Hers to address a wide array of consumer needs and facilitates cross-selling services to existing subscribers. So, how much money has the company made? The company has demonstrated a remarkable growth trajectory since its inception, rapidly expanding its market presence and financial performance. The company reported $872 million in revenue in 2023, which surged to $1.48 billion in 2024, representing a substantial 69% year-over-year growth. This strong momentum continued into Q4 2024, with revenue reaching $481 million, a 95% increase from the prior year, and Q1 2025 revenue doubled to $586 million, marking a 111% year-over-year increase. The company achieved profitability in 2024, reporting a net income of $126 million, a significant turnaround from a net loss of $25 million in the previous year. Quarterly profits also saw substantial increases, with $26 million in Q4 2024 and $49 million in Q1 2025. But you may be asking, what are the growth strategies the company has been using to achieve this level of growth? Hims & Hers employs a multifaceted approach to sustain its growth and expand its market footprint. These growth strategies include diversification of offerings. Building on its initial success in sexual health and hair loss, the company has strategically diversified its product lines to include mental health, weight management, and primary care services. This expansion aims to appeal to a broader audience, positioning the company as a comprehensive, one-stop destination for consumers. Enhanced telemedicine services. The company is continuously enhancing its telemedicine services, focusing on personalized consultations, virtual follow-ups, and seamless prescription delivery. AI and technology investment. A significant portion of the company's growth strategy involves deep investment in artificial intelligence and data capabilities. This includes expanding its data pipeline, developing advanced AI tools for personalized treatments, and enhancing decision-making tools for healthcare providers on the platform. These technological advancements are expected to improve service quality and expand the customer base. Strategic marketing. Hims & Hers allocates a substantial annual marketing budget, estimated at $150 million, primarily investing in digital advertising across platforms like Instagram and TikTok. The company also utilizes micro-influencers and broad brand campaigns, including high-profile Super Bowl ads, which we'll discuss later, to normalize conversations around sensitive health issues and amplify brand visibility. International expansion. The company has articulated clear plans for global expansion, pursuing both organic growth and strategic acquisitions in international markets. This ambitious international growth is being supported by a significant $1 billion convertible senior notes offering demonstrating strong investor confidence in its global potential. The company may be doing very well so far, but all of these growth and success isn't happenstance. So how did the company create all these results? Hims & Hers has proactively seized several strategic opportunities that have been instrumental in its growth. These opportunities include the use of generic medications. The company strategically entered the market by offering generic versions of popular medications, such as Viagra, Cialis, minoxidil, at significantly reduced prices, partly because they did not have to worry about patent restrictions for the medication since the patent for the medications has expired and any company can create generic versions of it. This approach directly addresses affordability barriers, making essential treatments more accessible to a wider population. By providing a cost-effective alternative, Hims & Hers has been able to attract a large customer base that might otherwise be deterred by the high prices of branded drugs. GLP-1 weight loss drug strategy. The company took advantage of unique opportunities to grow and expand using weight loss in two major ways. 1. When the weight loss medications were scarce, and 2. When the scarcity was over. Let's explain this. Initial approach and scarcity leverage. Hims & Hers expanded into the weight loss market in late 2023 with oral medication kits, and notably by adding compounded GLP-1 medications, such as semaglutide, to its offerings in May 2024. These compounded versions were priced significantly lower at $165 per month compared to approximately $1,800 per month for branded options like Wegovy and Ozempic. The ability to offer these compounded versions was facilitated by inclusion of GLP-1 medications in the FDA's drug shortage list, which allowed compounding pharmacies to prepare versions of drugs that were in short supply, even if not fully FDA approved. Shift post-shortage and personalization. The landscape for compounded semaglutide shifted dramatically when the FDA declared the semaglutide shortage was over on May 22, 2025, and removed it from FDA drug shortage list, effectively ending the broad permission for compounding. In response, Hims & Hers has pivoted its strategy. While it will no longer offer commercially available dosages of compounded semaglutide, it plans to continue providing personalized doses for patients with specific clinical needs, alongside new offerings such as generic liraglutide and branded tirzepatide, the active ingredient in Zepbound and Mounjaro. Partnerships with GLP-1 drug manufacturers. The Novo Nordisk partnership. A pivotal development occurred on April 29, 2025, when Hims & Hers announced a long-term collaboration with Novo Nordisk to offer its FDA-approved weight loss drug, Wegovy, directly through the Hims & Hers platform. This partnership, despite prior friction over compounded versions, presents mutual benefits. For Novo Nordisk, it provides access to Hims & Hers' extensive digital platform and its ability to deliver care at scale, potentially expanding the reach for Wegovy and addressing slowing sales amid increasing competition from Eli Lilly. It also allows Novo Nordisk to offer its FDA-approved product through a direct-to-consumer channel, potentially mitigating the impact of compounded alternatives. For Hims & Hers, the partnership secures access to a branded, FDA-approved GLP-1 medication, enhancing its credibility, broadening choices for subscribers, and effectively navigating the regulatory shift away from compounded semaglutide. Now remember what we said about using Super Bowl ads for strategic marketing. Hims & Hers faced significant backlash following its Sick of the System commercial, which aired during Super Bowl 59. The minute-long advertisement critiqued the pharmaceutical industry for pricing medications for profits, not patients, and promoted Hims & Hers compounded versions of GLP-1 weight loss drugs as affordable alternatives. The controversy stemmed primarily from the ad's omission of crucial safety and regulatory information. Critics and various health experts raised concerns that the commercial failed to disclose potential side effects and the fact that the compounded drugs were not subject to the same rigorous FDA approval process as their branded counterparts. The disclaimer was only displayed for 3 seconds in small, barely legible font, which many deemed misleading. Hims & Hers defended its approach, asserting that it complied with existing laws and that pharmaceutical compounding is explicitly permitted by the FDA and has been safely practiced for decades with oversight. However, the commercial led to a substantial 650% spike in traffic to Hims & Hers website, indicating a high level of public awareness and engagement. This dynamic interplay between Hims & Hers and established pharmaceutical players highlights how the company's initial strategy leveraged regulatory ambiguities monopolies, particularly the drug shortage list that permitted compounding to disrupt the market with more affordable alternatives. This approach inevitably led to direct confrontation with established pharmaceutical companies seeking to protect their patent-protected monopolies. The subsequent strategic evolution, marked by partnerships with branded drug manufacturers, demonstrates Hims & Hers' adaptability in navigating these regulatory and competitive pressures, seeking to ensure continued market relevance and growth. Hims & Hers has successfully positioned itself as a disruptive force in the healthcare industry by democratizing access to medical care for conditions often associated with stigma and inconvenience. Its digital-first, subscription-based model has resonated with a significant consumer base, offering a streamlined, private, and often more affordable alternative to traditional healthcare pathways. The company's rapid growth in subscribers and revenue underscores the effectiveness of its approach in addressing unmet needs in the market, helping it succeed in a market where other established players have struggled or failed completely. The future seems bright for the company, but it remains to be seen whether the company can sustain its success and performance far into the future. If you find any value in this video, please subscribe to this channel to get more videos like this.